Leadership is important in every aspect of being a nurse, from a new graduate all the way through a nurse executive.
I think the best nurse leaders are those that span boundaries.
You naturally want to do something to help others, and putting yourself forward is really just part of that process.
To get out of your comfort zone, you just have to take the risk.
Mentorship is so critical. It is a critical piece of this leadership campaign.
The Institute of Medicine, in its landmark 2010 report, The Future of Nursing, Leading Change, Advancing Health, deemed leadership so important it is one of the report's 4 key messages and 2 of the recommendations: to expand opportunities for nurses to lead and diffuse collaborative improvement efforts, and to prepare and enable nurses to lead change to advance health.
To me, being a nurse leader is being a voice for the community. I think it's really about bringing others to the table with you. It's serving as a mentor to someone else so that they can rise and become a leader.
Nurses, bring a perspective from the patient, but also work with physicians and other members of the healthcare team to make changes that will impact patients in the hospital, outside, in the communities.
They're energetic, rising nurse leaders with strong vision.
The Campaign for Action, created to implement the IOM recommendations, has turned a spotlight on nurse leadership. In 2014, the campaign named 10 breakthrough leaders in nursing to help transform the nation's healthcare system, create healthier communities, and build a culture of health.
I helped create the first nurse manager job share in North Carolina at my institution because I wanted to work. I had small children, so did my job share partner, and so we did the first job share in nursing.
My life took me in many different directions where I got to learn lots of skills, kind of practice some things out, and then gather it all back up and move back home and follow my dream and help to provide services to women who otherwise wouldn't have had them.
Leadership is about stepping outside of your comfort zone.
Well, I think you have to push yourself to be uncomfortable. I mean, that's how you learn. So if you're just doing the things that you're really good at, you're not learning and changing and growing.
I decided to go for an opening as a night supervisor, knowing that I had little chance to get the position because I was only 18 months into my nursing career. So it was a surprise when I was actually chosen for the position.
Leadership is about mentoring.
There are mentors that are formal, and there are some maybe that are even informal, and then there are some that seek you out instead of you seeking them out. But it's such an amazing part of our profession to mentor one another.
If you see someone that you want to emulate, you see someone that makes you have a wow factor, ask that person to mentor you.
And leadership means being at the table when policy decisions are made.
We must make sure that we are not just knocking at the door and hoping someone will open the door. We need to knock the door down.
To address the IOM statement that, quote, leadership is fundamental to advancing the profession, 20 nursing organizations have formed the Nurses on Boards Coalition to put 10,000 nurses on boards by 2020.
We can care very deeply about making things better for people through systems, through policies, but if we're not connected to the places where those decisions are made, then it's more a goal, a desire, a hope. We want more than hope. We want serious action.
To be a nurse means to be a leader. Nurses work to build healthier communities and oversee complex health care for people in hospitals, in their homes, in long-term residential settings, in schools, and wherever they live, work, play, and worship.
I'm on a school advisory board, and I approached it, and they said they needed a person in charge of strategic planning, and I said, I can do that, and they were surprised. I said, well, hospitals, organizations, that's what we do.
Sometimes it's just showing up. Whether it's an association, a larger organization, a committee, a board, what have you, showing up is half the battle.
Pathways to leadership are many, through community organizations, the PTA, neighborhood groups, nonprofit agencies, and in your workplace. Joining a committee and then leading it can be the first step to getting on a board of directors and making policy decisions about healthcare.
Find the things that you're passionate about. Find the things that you love. Those are the things that you'll shine at because your heart will be in it.
Nurses, some 3 million strong and the most trusted healthcare profession in the country, are passionate about their profession and dedicated to helping others. The message from the IOM and the Campaign for Action is that nurses need to be just as dedicated and passionate about taking roles in making policy.
We can't get any of this done without nurses stepping up to the plate and being those leaders that we need.
As Florence Nightingale said, to be in charge is certainly not only to carry out the proper measures yourself, but to see that everyone else does so too.